So, I want to dive a little bit more into exercise and actually the evidence base behind exercise, how to do it well, how to keep yourself accountable, and how to actually have an impact on your health. So, we're just going to dial back, as I always do, to my six pillars of wellness. With that, I really feel that exercise is intertwined amongst all of these pillars, not just exercise on its own. So, exercising with friends gives you that social connectivity. We know that our brain gut axis is very active. So, putting good food into our system makes you feel better, makes you feel more motivated. Decreasing toxic substances. We know that if you had a big night on the alcohol, you often just don't feel like exercising the next day. It's a bit of a recovery day. So, decreasing toxic substances is really important for improving and incorporating more exercise into your life. Exercise improves sleep and it reduces stress. So, lots of reasons to really dial into exercise. Physical inactivity is the fourth leading cause of fourth leading risk factor for global mortality. So, mortality being death, according to the World Health Organization. Inactivity contributing to 3.2 million deaths annually worldwide. And we know that actually, if we were to improve our exercise, if we were to increase our exercise, then we can reduce cardiovascular disease by 20 to 30% and type 2 diabetes by 25 to 35%. So, if we can get some regular exercise in, we can reduce chronic diseases, improve our mental health, and we can really factor in a bit more longevity. So, recently, there was some fantastic evidence come out of UQ in Brisbane, where exercise was shown as to be as effective as antidepressants and psychotherapy for depression. So this is a big one here for me. Antidepressants are definitely an important tool to use in that moderate to severe depression and anxiety. However, they do have side effects. They're often very blunting. And whilst you will not have the terrible lows, definitely not have the highs quite so much. There's also a huge impact on things like your libido, and patients will report weight gain as well. So, um, looking at using exercise as your first line treatment for depression and anxiety, I think would be a real change of tact for ourselves as doctors. But as patients, if you're feeling low, if you're feeling down, it is really something I want you to start thinking about leaning into. It's hard because often when you're feeling low, it's the time when you have least motivation. And that's when you've got to push through. That's when you've got to keep yourself accountable. And we'll talk about that accountability and the habit formation as we go. So, we know also exercise will improve things like pain. It will improve things like chronic low back pain in particular. But we also have to look at that sort of evidence around what makes patients stick to a program long enough to get these benefits. So, looking at adherence and dropout rates. So, this is the research from UQ, which I just loved. And without being overly technical, I wanted to look at, in particular, at things like walking and jogging, dance. Of course, dance having a huge clinical benefit because it's social, it's interactive exercise. But also things like look at that where SSRIs sit, SSRIs sitting down here at the bottom, alongside things like just telling patients to exercise. So telling patients to exercise can actually be a bit counterproductive. And that's where I'm here today saying, I'm not just telling you to exercise, I actually want to give you some goals. And I want you to set goals that are accountable and that are evidence based. So the World Health Organization have quite big recommendation looking at 150 to 300 minutes of moderate exercise for adults per week. Really, especially when you're starting out, that would involve you exercising at least 4 or 5 times per week. So when we start exercising, I am asking my patients and I'm asking you not to dip your toe in. I need you to actually go wholeheartedly into this. And we're looking at frequency as our biggest tool. Intensity will come later, but at the moment, frequency. So, what we decide to do next is we decide on our 5 days of the week that we're going to exercise. And that might be for you, you do 4 days through the week and a bigger session at the weekend. I know as a runner, 5 days is a lot to achieve. So doing, for me, 4 days through the week and a long run at the weekend works. And I can work in some strength exercise through the week as well. And we're going to give you those goals too. So with your aerobic activity, if it's running, if it's jogging, if it's walking, if it's swimming, if it's deep water running, if it's cycling, what I want you to do is commit to your 4 days per week that you are going to do aerobic activity. 4 days per week of aerobic activity in order to get your minutes up. And then strength activity, at least 2 days per week, targeting your major muscle groups. So strength training doesn't have to be in the gym lifting weights. It can initially just be your body weight. So this is things like press-ups, this is things like squats, and then adding weights as we improve, as we get stronger. And for our older adults, and that's for me, I consider myself an older adult, not quite into the 80 plus group. But as you, especially women, approach 50, it is really important to be including balance and coordination exercises into your routine, and that is to reduce fall. Fractures to the hip are particularly life changing and life ending and life shortening injuries. So getting this balance and coordination in is going to be part of our targets here too. And replacing sedentary time with light activities where possible. There is evidence to suggest that after eating, going for a walk can actually decrease your blood sugar. So rather than after main meals, sitting down watching telly, I want us to be going for a light walk. Taking the dog out for a walk round the block is plenty. So, practicals. I want us to look at our modalities. So, what's your aerobic exercise going to be? Make a decision now. Think about what you can actually manage. It might just be walking. If you've got struggles with your joints, we know that increasing aerobic activity will actually improve those joint pains. However, if you feel that walking or running is out of the question, getting into the pool, deep water walking can be really, really hard going. Exercising in the pool can take the weight, but give you a good workout. And then looking at what you're going to do for your strength training. Is it things like yoga? Is it things like Pilates? Or do you want to hit the gym? So have a think about what you can incorporate into your week. So structured group programs yield 25% higher adherence rates. And it's really good for your social interactions. So I want you choosing an activity once a week that you do with friends. And that might be a walking group. There are fantastic walking groups in Brisbane. It might be a dance class. It might be a yoga class. It might be a HIIT class. Have a think. One activity you do per week with a group at least. So behavioral techniques, and what we're talking about here is accountability check. Now, having an accountability partner is really, really useful. For me, with patients, I actually get them checking back in with me. And I've been learning that a monthly check-in is not enough. Those accountability checks need to be 2 weeks, and we need to be looking at the activities that you have managed in that time. Self-monitoring using smartwatches, mobile devices are useful, and it can increase compliance by 40%. lots of our running group and cycling friends will say, if it's not on Strava, it didn't happen. And again, it's that accountability. It's recording what you do and being open about your intention. So find your accountability partner. Is that me? Am I your accountability partner? Are you going to start coming to me each 2 weeks for that accountability check-in? I need to know. Get in contact. So again, to reinvigorate you, the benefits are huge. Mental health is improved immensely by exercise. Your physical health improved immensely. Your longevity up to 7 years longer if you are moving more. And we know that actually it could be saving our healthcare significant amounts. So if you look at the current struggles of your healthcare um, in UK, in the US, in Australia, by having a more active population, we are improving the healthcare of the nation. So practical advice, let's get to it. I want us to have a FIT VP principle, FITT VP principle. And that's frequency, intensity, it's time, it's type, it's volume, and it's progress. So frequency, how often does physical activity have to be performed? We are starting off with 4 aerobic exercise sessions per week, and we're wanting to be moving at least 5 times per week. So we want to have that intensity initially, something that we can enjoy. We want to be able to, for example, run, be able to chat, but not be able to sing. We want to be able to do the exercise for enjoyment and not kill ourselves and put ourselves off initially. So step 1 is frequency. Intensity level is initially moderate. We don't need to be pushing ourselves too much when we start. If you're already someone who is doing a lot of exercise, then you're stepping up to the vigorous stage. I want patients to be able to manage their exercise well, and I want you to feel that you want to keep on doing it. The type of exercise, again, I am going to be absolutely prescriptive here. You're choosing running, walking, dancing, swimming, or cycling. You are choosing a moving exercise that you will be doing 4 times per week at least. Resistance training, we're going to be doing that twice per week. And we are going to be doing things like initially, if you're a complete neophyte, a very starter exercise enthusiast, this is body resistance. This is squats. This is press ups. And we're looking at doing just 20 minutes of resistance training, maybe using a resistance band. And I'll put some links to exercise classes at the end that you can do online, you can do from home. But also, as I mentioned, doing something like a class is useful. Doing something with other people can be the accountability partner that you're looking for. The duration initially is just going to be 30 minutes per session for aerobic activity, and for strength training, 20 minutes. Volume we will build up over time. Z initially, it's all about frequency. But we're looking at volume as frequency times intensity times time. So as we increase our intensity and increase the time spent exercising, we will increase our volume. And that progress is about gradual increasing of the volume. Looking at the variables frequency, intensity, and time, and improving these over a period of 6 weeks. So from today, we're looking at 4 30 minutes aerobic activity per week and 2 20 minutes resistance training. And that is your frequency, your intensity is moderate, and your time is laid out there. We're looking at having 6 activities over the week, but you can do it over 5 days if wanted. So ideally, collaborating with a physiotherapist or exercise physiologist is useful. However, leveraging technology, tracking your progress can benefit you also. Having regular follow-ups, either with our community here at Aurora Wellness or with a health professional. So, our goal, for example, in this individual, I've got a 50-year-old man where we're looking at decreasing his blood pressure and improving cardiovascular health. So we'll call him Bob. So I've asked him for 5 days of the week, Monday, Wednesday, Friday, Saturday, and Sunday, to be active. Intensity, we've said moderate. So we're going to look at his heart rate and we're going to be going for 50 to 70% of his max heart rate. So if when we exercise, we can get our heart rates up to 120, 150, 160, 180, we look at that as your max. And then we say, right, we're starting off at your heart rate is going to be sitting roughly around about half of that. So I know that if I run at a moderate intensity, my heart rate will go up to 180. So I know for me, that's my heart rate of going about 90 will work for me. We use the talk test. We can talk whilst you're exercising, but not be able to sing. Starting with 20-minute sessions for strength and 30-minute sessions for aerobic activity. And again, if initially 20 minutes is too much, 30 minutes is too much, 20 minutes will do. It's about the frequency. It's about developing the habit, and the habit comes with frequency rather than with intensity or time. And we're starting brisk walking for this chap there, Bob. 5 kilometers an hour is pretty slow, but getting him up and walking a bit faster than that, we can get up there and start progressing. So the weekly goal, 150 to 300 minutes. Increase durations of his exercise by 5 minutes every 2 weeks. We're going to get there. The strength training aspect, building muscle and strength, reducing your falls risk as you age. But for the moment in time, it's about 2 non-consecutive days of the week that you're doing some strength training. And as I said, that can start with press-ups and squats. It can be an exercise band, or it can be some light weights. The intensity is again moderate, maybe just starting off at 8 reps and building up to 12 or 15 reps as you improve. Initially 20 minutes, but building up to 30-minute session, targeting your major muscle groups. Squats, wall push-up, resistance bands, rowing, these things are all useful for that resistance training. Start with 1 set per exercise, so that's 12 reps, or if you're starting out low, 8 reps, and building up to 2 to 3 sets by week 6. Progression, gradually increasing your resistance and your repetitions every 4 weeks. We're going to get there. It doesn't take long. Flexibility. Look, I'm adding this in because I think it's important. Again, I'm probably sounding like I'm preaching only to the elderly, but flexibility is really important as we get older. Being able to get yourself up off the ground, working on your mobility, your posture, your balance, all really important. So if you can, add in a little bit of flexibility work at the end of your session after aerobic or strength sessions. Bit of stretching, bit of balance, heel to toe walking, single leg standing. Or as we said, maybe a class like yoga or Pilates. So, this is my call to action. Exercise is medicine. Prevention and treatment for chronic diseases. Let's prevent a chronic disease from actually occurring. Let's treat what you've got. Incorporate this evidence-based exercise into your routine for every week. I want you to feel empowered to have lasting benefits. I want to make exercise a cornerstone of healthcare. A couple of resources if you're feeling a bit lost. Couch to 5K is a brilliant, easily accessible Googled resource. Coaching Zone in most big gyms now, a really good social group where you do a little bit of competition, you do a lot of encouragement, and you work to what's called your METs. And that is, again, looking at your heart rate to see how you can get into those good zones and and try and build your metabolic tolerance. Park Run, Pumped, Bodybot, and Muesli are all easy and free, accessible websites and apps that you can use to increase your activity. However, if you would rather, continuing with this 6-week course, I'm going to be giving you marked exercises that you can choose from and tailor to your own ability. For a little bit more information, you can see Dr. Lynne Reid at drlynnereid.com, or you can have a little bit listen to more of the Aurora Wellness podcast. We've also got the app that you're now following, and hopefully we'll get you all moving a bit more.